My name is Danica Todd, and I have a little bit of a window between clients today. Someone needed to reschedule their appointment this weekend, and so it's allowing me to catch up on a couple of the videos that I have been waiting to record for you guys. And one of them I wanted to talk about is the importance of your pillow system while you are pregnant. And so a lot of the pillows that are out on the market, everybody's trying to find the next best thing to get everybody to buy these expensive pillows. And they are often pulling on the joints and the hip, which is causing, or I guess rather contributing to the discomfort while sleeping that is having people toss and turn all night. I want to make sure I'm very clear that adjusting your pillow system is not going to make this completely go away. It is triggered by the relaxin hormone that is systemically going to the joints in the full body, but specifically we want in the hips for labor. And so we're not trying to combat that. We're just trying to support your body while you have that relaxin hormone flowing through it. And you also have that relaxin hormone in your body until 6 months postpartum, or you stop producing breast milk, whichever is longer. And so it will slowly titrate after birth to that 6 months, and then it'll downshift. And then as the baby switches over more and more to solids, there will be less and less relaxin hormone as you're producing less milk. But that relaxin hormone is going to stay in your body. So we're just trying to support your body during this beautiful, amazing time. We're not trying to stop the relaxin hormone from doing what it needs to do. Unfortunately, one of the ways we feel the most comfy when we are resting is to have the pillow between our knees. And I'm noticing a lot of these prenatal pillows are done in a way or curved in a way that only allows you to use it when it's only between your knees. And what's happening is it's putting pressure, when it's just between your knees, it's putting pressure up here in your SI joint. So all of the supporting anatomy that is unstable from that relaxin hormone is causing strain here, and then it can cause strain here. So there's a pulling in this joint as well. So I want to show you what that looks like. I'm going to transition up to the massage table. So let me change this angle a little bit so you can see. And I'm going to climb up here. So a lot of the systems will just have the pillow in between the knees. So what you can see is my bottom leg is straight. It's supported. I'm lifting up while I'm talking, but you can imagine if I was sleeping like this, the bottom part of my body is completely supported by the massage table. But notice how my top leg is kind of coming up and down and around. So look at my hip and my thigh bone, and watch as I drop my leg around the pillow in between my knees. See how it does that rocking? So there's this rocking. So here's level, here's the pillow in between the knee. So there's a time in labor that this might be indicated, because what happens when you do that is you're creating space in the inlet. So if the baby's head is still kind of high in the pelvis and you're in labor and they're trying to get the baby's head to come down, they might put that peanut ball in between your knees, and they might have your leg hanging off, so that they can get that baby's head in, or they can get the baby to rotate, or whatever they need to do. There is a time and a place for this therapeutically. However, sleeping at night is not it. Sleeping at night, you want to be as neutral as possible. So when you sleep at night, it would be better for you to have a king-size pillow. You have your bottom leg, the pillow lays completely on top of it. I know you can't see my foot. Sorry, it's out of the shot, but my foot is underneath, and my top one is right on top of it. Now you can see that my hip to my knee to my foot are all in the same plane, which is going to restrict strain on these joints. And this might allow you to get a little bit longer sleep. You may not be sleeping through the night for other reasons while pregnant, but this will allow you to be more comfortable longer. At some point when you're sleeping, your leg might fall off, the pillow might shift, who knows what happens. You wake up, you're like, ugh. Now it's time to turn over to the other side. You just reset it. Just come back to resetting it every time you can. It's not about waking yourself up to get in this position as much as it's about returning to this position when you wake up. Another position that you might see as you're preparing for birth, if you're looking at spitting babies even, is that there's also one where the pillow is only between the feet and the knees are together. So this does the opposite. This looks like it's closing off your pelvis, but it's actually opening the inlet. So here's neutral. Here's what it looks like if it's between your knees. This is what it looks like if it's between your feet, especially those big peanut balls they have at the hospital. This is taking that sit bone and moving it out of the way. So if you've got a baby who's already down in the pelvis and you're helping them get out the bottom half, then you would be putting your pillow or your peanut ball in between the feet. But again, this is not something that you would be doing long term while you're trying to sleep through the night. This is something that you would be doing strategically short term for homework or while in labor. But while you're sleeping, you want to be in neutral. The other thing I want you to look for when you're looking for your pillow is try to find something that can hold its shape through the night. So I have, these are knockoff ones in the office, but I have the Coop at home. It might be on the other end. What I like about these is they have a zipper. The Coop one has a zipper as well. The Coop ones are definitely more expensive. I will also say they last longer. I feel like these cheaper ones on Amazon, you might get a year out of them and then you're gonna need to buy a new one, which if you're only planning on using it while pregnant, is a great. It's got an outer layer that you can wash. It's got an inner layer. And then the memory foam, let me see if I can get some of this out without making a big mess. The memory foam is pieces of memory foam. Now this memory foam on this knockoff pieces are much smaller chunks than the ones in the Coop. So I do find it tends to flatten out again, like faster, meaning maybe only lasts a year. But this allows your body to contour into the foam, but unlike those cotton polyfills, those traditional ones, it's not going to completely flatten out by the end of your pregnancy. It'll bounce back. When I was pregnant with Dharma 21 years ago, we just had polyfill. We didn't have any of these other options. And by the end of the pregnancy, there wasn't even any stuffing where your knees would go. Everything had moved down to the ends. You had nothing. You were just knee on knee. And so that's what I like about these. The additional benefit of the Coop, if you're gonna go that route, is that they send you an extra bag of stuffing. So as it begins to flatten over time, you can add more stuffing in. Depending on your size, if you're petite, you may not need this with all the stuffing in it. It might take your leg out of being in that neutral plateau position, and it might end up having you higher because of your petite frame. You can go in, take the stuffing out, put it in a Ziploc bag or something to store for later, and make the thickness of the pillow the right distance between your knees so that the distance between your ankle, your knee, and your hip are all the same. So it allows you to have some degree of flexibility to customize the thickness of the pillow to your body and your needs without compromising the stability of the foam, which is what's gonna help you get that better rest while you're sleeping. If you have any questions, please don't hesitate to reach out or throw it in the comments. And I hope this was helpful. Thank you.